Hello, everyone. Welcome to a short presentation from my med-surg group on male reproductive health. We're going to talk about male contraception, male fertility. The first bullet point on here is older adult considerations. Remember, an older male can get a woman pregnant up into his 70s. So it's just something to keep in mind. For contraception, one of the things you have to think about is the fact that, for a man, if you're going to develop contraception, you have to prevent the sperm from coming out every day because every day the man makes millions. And you think about a woman, she only releases an egg once a month. If you Obviously, anyone who wants to prevent pregnancy, abstinence from sex would be the first choice. But the currently available birth control for men would be condoms or a vasectomy. Now, condoms are called the barrier method. And as you know, they prevent semen from reaching the egg to fertilize it. But the vasectomy is permanent. Now, they do vasectomies as an outpatient. And I've seen them done in offices or clinics, and they treat them just like a regular surgery, and they have to sign a consent form. Now, here's the thing. A man who's going to get a vasectomy needs to know it's not guaranteed. It's supposed to make you sterile, but I have met men in my nursing practice, and I have heard of other men, the vas deferens has grown back, and a woman, maybe they were married, and the mom comes in and she's like 40, and she goes, my husband had a vasectomy. I don't know how I got pregnant. Well, this is not a guaranteed procedure. And they use all the surgical concepts that you learned about surgery before you do the vasectomy, like don't take aspirin or ibuprofen before the surgery. They're worried about bleeding. They want to know all the over-the-counter medicines you take. And there also now is, they actually have a vasectomy reversal surgery where they can go in and reconnect the tubes that carry the sperm from the testicle into the semen area. And so that may allow a man to get his partner pregnant. So let's talk about treatment options for erectile dysfunction. First of all, what is erectile dysfunction, or ED? Erectile dysfunction is an inability to get and keep an erection firm enough for sexual intercourse. Estimates suggest that 1 out of every 10 men actually suffer from ED at some point during their lifetime. It is important for you to understand as nursing students that ED is a symptom of another underlying problem. It's not considered to be normal, and it can be associated with other problems with sexual intercourse, like problems with ejaculation. So what causes ED? It can be caused by a number of factors. Vascular disease, when blood supply to the penis becomes blocked or narrowed as a result of vascular disease like atherosclerosis. Neurological disorders, something like multiple sclerosis. The nerves that send the impulses to the penis, they become damaged, and they can become damaged from a stroke or diabetes or some other cause. Obviously, psychological problems like stress or depression, they can contribute to performance anxiety. Any type of trauma, an injury to the area. Chronic illnesses, there's a condition called Peyronie's disease that can also cause ED. Any type of operation for the prostate, bladder, colon cancer operations. And because there are a variety of causes for ED, there's several different things the doctor could possibly use, but they have to find out what's causing it. But before they would think about doing any kind of testing, they're going to review your medical history and do a physical exam. They have to interview the patient about their personal and sexual history, and some of the questions can be personal and intrusive. And the first choice, or the optimate choice now, is the drug class that includes sildenafil and tadalafil, which are Viagra and Cialis. And those are the drugs in this class that have been pretty groundbreaking. They will improve, when you take these medications, they improve the ability to get and keep an erection. They also are being used to improve the ability to exercise in adults with pulmonary arterial hypertension. It is my understanding that they can use them in children having those problems also, this drug. So kind of have to think about that. There also is obviously sexual therapy. If someone's having a depression, they would need to go to psychological help and get someone to talk to. And we're going to talk about penile implants and negative pressure devices on the next slide. after I had given this little lecture last term, we realized that some of the students needed some photos to kind of help them understand some of these treatments for ED. So that's what I have here. So I'm going to start on my, actually I started on my right here in my notes. You can probably hear me click in my notes here on my other little screen. But the one on the right, the picture on your right is called a vacuum constriction device. And a vacuum constriction device is an external pump that a man who has ED, he can use, and he can use it to maintain an erection. The pump goes on, it helps the penis become erect. There's a band that's kind of attached to the pump to help maintain the erection. The picture on the left is what's called a penile implant. It's a device that's actually placed inside the penis to allow a man with ED to get an erection. These are usually only recommended until when other treatments for ED have failed. Let's talk about health screenings and assessments. Obviously, this is about men in this particular presentation, so we're going to start out with a testicular self-exam, which is an inspection of the appearance and feel of the testicles. Men can do this themselves. Usually they do it in front of the mirror. To do a routine testicular self-exam would give a man a greater awareness of any conditions on his testicles and hopefully to help them detect changes. You hope that the man knows how to do this correctly, and we have to do a lot of teaching in nursing. We want people to be well. The second bullet point on here talks about tests for general states of health. And guys, think about this. This is your routine screening things that we try to teach you early on. People need to go for a colonoscopy, and men need to go in and have things checked. And men tend not to go in to have things taken, looked at, and checked out. So they sometimes need a lot of support to be well and have self-care. The last topic on this slide is protein-specific antigen, or PSA. And what PSA is it's a protein that is produced by normal as well as malignant cells in the prostate gland. The PSA test measures the level of PSA in the blood. They send over to the lab and have it checked out. The blood level of a PSA is often elevated in people with prostate cancer. This test was originally approved in 1986 to monitor the progression of prostate cancer in men who had the disease. Now, the FDA has approved to use this PSA test in conjunction with the digital rectal exam to aid in the detection of men over the age of 50. So, what PSA, it's a tumor marker. We actually know now that tumors send out a marker that they can test. So you're going to see this tumor protein marker come up in other reading when you do. There's one for women for breast cancer. They can actually detect that you carry the gene or markers for certain cancers. So this is kind of something you're going to see as you go along in your nursing career. I wanted to share some more problems that medical issues that men can have. This slide is about a varicocele, which is an enlargement of the veins within the loose bag of skin that holds the testicles. These are the veins that transport oxygen-depleted blood from the testicles. A varicocele occurs when blood pools in the veins rather than circulating efficiently out of the scrotum. And some of the students last term mentioned they'd like to see a visual aid on this. I was able to find a photo here, and you can see in this picture on the left what you're going to see if you, when you do your assessment, what this varicocele looks like on the outside of the scrotum and the testicle area. I have two additional male diseases listed here. The first one that I have in my notes is a hydroseal, and that's a type of swelling in the scrotum that occurs when the fluid collects in the thin sheath surrounding the testicle. It's actually common in newborns. It usually disappears without treatment by the time the newborn is age 1. There are older boys and adult men that can develop this hydroseal due to inflammation or some sort of injury. The second disease actually is on your left as you look at the screen. It's Peyronie's disease. It's a non-cancerous condition resulting from scar tissue that develops on the penis, and it ends up causing a curved, painful erection. And if you look there in the very characteristic that they call it the carrot disease, the penis kind of has a bend in it. It almost looks like a bent carrot. Let's talk about benign prostate hyperplasia. The prostate gland, as you know, located beneath the male's bladder. And the tube that transports urine from the bladder out of the penis passes through the center of the prostate. So when the prostate enlarges, it blocks the flow of urine. So now most men have continued prostate growth throughout their life. And this continued growth can enlarge the prostate enough to block this flow of urine. And they're not entirely sure what causes the prostate to enlarge. They could be sex hormones changing as they grow older. But so here are the symptoms that you tend to see in men. And the severity of the symptoms can vary. The symptoms tend to gradually worsen over time, but the most common signs and symptoms are a frequent or urgent need to urinate. And sometimes I'll have a man, he'll like void 25, and I go to wash my hands and head up the hall, and the light will go back on, the cold light will go on again, and they've gone another 25. They're not emptying their bladder completely. Sometimes there's an increased frequency of urination at night, and you guys know that's called nocturia. They'll have difficulty starting their stream, a weak urine stream, a lot of dribbling at the end, inability to completely empty the bladder. There are some less common signs like getting a UTI or blood in the urine. Some men have really terrible symptoms with this. It just depends on the particular man. When they go to diagnose benign prostate hyperplasia, they do a digital rectal exam. They can do pressure flow studies or an ultrasound. I have seen men have like a post-void catheterization. And on the next slide, we're going to talk about treatment. The first line treatment for BPH is drug therapy. And there's two classes. You learned these when you were in pharmacology, but we can review them quickly here. The first category is alpha blockers, and these medications relax the bladder neck muscles and muscle fibers in the prostate, making it easier to urinate. This includes the drug tamsulosin, which is very common, called Flomax, and doxadosin, which is Cardura. And they usually work very quickly in men with smaller prostates. There are side effects to these drugs, and that's dizziness, and we worry about people falling. And that doesn't, that's always a risk for folks with these particular drugs. The second drug class here is 5-alpha reductase inhibitors. And these medications actually shrink your prostate by preventing hormonal changes that are causing the prostate growth. One of the chief drugs in that class is finasteride, which goes by Proscar, and they may take up to 6 months to be effective. The other thing that we talk about when we talk about herbal supplements in pharmacology is the drug saw palmetto. I don't know a lot of research on the saw palmetto, but men do take it to try to help this hyperplasia. And of course, obviously, if these don't work, that there would have to be surgery. We're going to talk about that on the next slide. We're going to talk about some surgical treatments for problems with the prostate. The one here particularly that I want you to know about is called a TURP, or a transurethral resection of the prostate. Anytime you see the word resection, that means surgery. Okay, so basically what they do in this surgery is they enter through the tip of the penis and go in and they kind of clean out the prostate area. I'm going to use the term roto-rooter lightly, but they're going to have to clean that area out in there. If you go over to one of the sites like YouTube, you should be able to see some of these surgeries actually in real time have been posted. But what I want to talk about is the nursing care, only because there's some issues with this particular surgery on the prostate that they want you to know about. Okay, so what's going to happen here is when this patient comes back from having this TURP procedure, he's going to have in what's called a Murphy drip, or a continuous bladder irrigation. And I don't know if you can see it here from this picture. If you decide you'd like me to print this picture, shoot me an email and I'll get it for you. But instead of the regular Foley, it's going to have a 3-prong Foley. So on the 3-prong Foley, one of the prongs is to inflate the balloon. The second prong on the Foley is for the urine to drain out, and the additional third port is to irrigate. And these are huge bags of irrigation that are going to be hanging at the bedside. And you have to watch to maintain this catheter patent, because there's going to be some blood clots coming on. You want to make sure there's not too many blood clots, or there's not too much bleeding coming from inside that area. That urine is supposed to look a little bit like Kool-Aid, red Kool-Aid on this first day, but it's not supposed to be clotting off or having so much blood that you're worried about this person's vital signs after surgery. These patients get a lot of bladder spasms. I've seen them get opium and belladonna suppositories rectally to help with this. A lot of pain control. this first 24 hours for this. You'd be surprised how painful this is for these gentlemen. We want to make sure that we keep their activity limited for a short time before we go starting getting them up. We don't want them straining with their bowel movements. We want to make sure there's plenty of fiber. We may have to give them some laxatives. We are worried about that hemorrhaging through that catheter. Bleeding should be decreasing down to a light pink within 24 hours in that Foley. We need to teach these men Kegel exercises. And for those of you, most women, when I say Kegel exercises, the ladies all kind of nod their head at me. For those of you that don't know, I'm going to tell you, gentlemen, if you don't know what that is, I want you to go look it up. I want you to be able to tell me as a patient, pretend I'm a patient and tell me what Kegel exercises are. We worry about infection, obviously, and obviously this person had surgery, so all your surgery education comes up. We want to prevent a DVT. They may be on the low-dose heparin. We want to make sure that they're not sitting for long periods. So you have to kind of think about that and keep that in mind. I had some students ask for a picture of a what's called a continuous bladder irrigation system, so I provided you a picture here. The irrigant here, it's usually an isotonic solution irrigant going through the one port. Obviously, your bulb inflation port is here, and the Foley bag goes to the third port. In addition to this TURP procedure, transurethral resection of the prostate, there are some newer treatments that are being used that have less side effects. One is a transurethral Electro vaporization of the prostate. It's kind of similar, but they basically go in there and kind of just vaporize the prostate, and it seems to have a better outcome for men. There's less bleeding and less problems. Something else they can also do is a urethral stent, which would be going in there and putting a stent in there just to open up the area. And obviously, the last treatment that I have listed here is a laparoscopic radical prostatectomy. This would be someone suffering with cancer. They'd have to take the radical prostatectomy. They remove the entire prostate gland and sometimes nearby lymph nodes if they have prostate cancer. Some of you mentioned that you do like the audience response questions, so I left one here for you. The question, a 65-year-old man has decreased caliber of urine stream, hesitancy, dribbling, urgency, and a digital rectal exam revealed an enlarged prostate gland. Your nursing interventions would include, and this is select all that apply. Number 1, decrease caffeine and artificial sweeteners. Yes, that is correct. Number 2, limit spicy foods and alcohol. Yes, that is correct. Number 3, apply a condom catheter. Yeah, that's not correct. Number 4, restrict fluid intake. That is not correct. Number 5, plan a timed voiding schedule. So your correct answers here are 1, 2, and 5.